like to invite Sylvia M. and Sarah Haithcock from Duke Health USA to deliver the first keynote talk. Before the presentation begins, allow me to introduce our first keynote speakers. Sarah Haithcock is the Director of Nurse and Patient Care Retention in the International Nurse Program at Duke Health. With 25 years of nursing experience, she focuses on efforts to recruit and retain nursing talent through a multitude of program initiatives, including professional development, recruitment strategies, meaningful recognition, supplemental staffing, and international nurse recruitment. Sarah has led a small team to onboard over 300 internationally educated nurses into Duke Health over the past 2 years. Program analysis demonstrates successful performances and retention outcomes with the onboarding and supportive strategies designed by this team. Previously, she served 9 years in progressive leadership roles with Duke Health's neonatal ICU. She holds a Bachelor of Science from the University of North Carolina at Wilmington, a Master's of Nursing Science from Queen's University. She is an active member of AONL, and she is an advocate for healthcare worker immigration. Sylvia M. Alston serves as the Assistant Vice President of the Nursing at Duke Health. In this capacity, she leads the system-wide initiatives related to nursing support, retention, workforce development, career development, and staffing operations. Her professional expertise encompasses workforce planning and development, cultivating positive work culture, nurse recognition, optimizing scheduling and staffing strategies, effective recruitment, and creating effective incentive programs. In addition to her leadership responsibilities, Ms. Alston is committed to advancing nursing excellence through mentorship and innovative practice. She actively collaborates with interdisciplinary teams to implement solutions that address the evolving changes of healthcare. Passionate about empowering nurses at all strategies of their careers, she advocates for continuous education and professional growth. I call upon Sarah Haithcock and Sylvia M. Alston to give their keynote talk.
Good morning. I am excited to kick off this conference. I'm really excited to kick off this conference for a variety of reasons. One is I really have a passion about growing on the clinical workforce. And I also like quotes, so I want to start off with 2 quotes. My first quote is contributed to someone named Branson, and Branson said, train people well enough so that they can leave. Treat them well enough so that they will stay. So I think that's really important. So we have to grow them, but we also need to retain them. So growing the workforce is an essential strategy for any hospital or health system. A well-trained workforce is required for institutions to be able to execute on their mission. The second quote is from Benjamin Franklin, and Benjamin Franklin said, by failing to prepare, you are preparing to fail. So as the healthcare environment evolves, we have to be prepared. So today, Sarah and I will share some tools that will help you to prepare. So we have 4 objectives that we'd like to cover. One is when you think about the role of a leader, we want you to actually understand and be able to identify those foundational elements for clinical workforce planning. And it really needs to be something that every leader work on every single day. The next objective is to be able to develop a robust recruitment plan because we need to be able to meet the volume needs as well as the complexity in healthcare. Thirdly, we want to talk through and talk about some structured programs because it's really important to be able to do structured programs, be able to evaluate those programs, and look at return on investment. And then lastly, we want to talk about some recruitment strategies to include things like specialized roles, job sharing, and ways to expand your pipeline. And when I started, I failed to actually recognize two of my other colleagues. So we have two of our other colleagues, and they actually have a poster, and there's one piece of the presentation we will just briefly talk about because they have posters that will actually explain that really well. Who we are. So Duke Health, we have actually 4 acute care hospitals. We have Duke University Hospital, and that is a 1,000-bed academic hospital. We have Duke Raleigh Hospital, which is a campus of Duke University Hospital, and it is a community hospital that actually specializes in neuro. We have Duke Regional Hospital, which is another community hospital that specializes in orthopedics. And then in April of last year, we acquired another hospital actually in the Charlotte area, so Duke Health Lake Norman. We're in the process of building another hospital in Cary, which is about 15 miles from our main campus. We have Duke Primary Care. Duke Primary Care is made up of our primary care clinics. And then we have our Duke Healthcare Integrated Practice. And the integrated practice have both primary care as well as specialty care. We have about 205 clinics that is part of Duke Health. And then we have home care and hospice. So that's who we are. So one of the things about Duke is it's really important for us to impact the lives of the folks in our community. So quality is really important to us. So just wanted to share some information about quality, looking both at our leapfrog scores, our CMS scores. We constantly are actually ranked in the top, at least the top 20 in many of the surveys. So we place a lot of importance on quality. I want to talk about sort of the number of lives that we actually impact and the number of employees at Duke Health. We actually have over 45,000 employees. So when we think about being able to grow the workforce and also to be able to sustain the workforce, we have to impact on a lot of individuals. So when we look at the priorities for Duke Health, growth, access, and people are the priority. So today we're going to be focusing on that priority of people. And when we think of people, we think of, again, recruitment, retention, workforce safety, are all components of our people strategy. And I think as institutions and health systems look at their priorities, having actually people as one of those really key priorities is essential. I want to talk a little about the current healthcare workforce. Actually, I recently read an article, and they had actually interviewed multiple nursing leaders and other healthcare leaders, and they actually asked them, what is keeping you up at night? And when they asked leaders what is keeping them up at night, what the top answer was around the ability to recruit and retain staff, and especially staff that provide direct care. So not just nursing, but RT and other staff that provide direct care. So also, especially when you look in the U.S. about what are we facing right now, we actually know that we will actually continue to have a shortage of health care at least through 2038, and they haven't done projections beyond that. We actually know that in general in rural areas that that is higher. We know with direct caregivers, the gap will be even greater. And as we actually look at new technology, as we actually look at the aging of the population, we actually know that that will continue to grow. And we are actually anticipating a 12% shortage of healthcare workers. So we have to actually think of ways to, first of all, to upskill our current workforce, to retain our workforce, as well as what are those pipelines? And again, we will discuss some of those pipelines with that. So now we're going to actually transition, and we're going to start talking through some of our pipeline strategies. So I'm going to turn it over to Sarah, and Sarah will actually walk us through some of the pipeline strategies.
Hello, I am Sarah Haithcock. Thank you, Sylvia. So I will talk about some of the pipelines that we utilize at Duke Health, as well as some of the workforce development strategies that we use. So the first program I'm going to talk about is our professional nursing assistant program. This is a 10-week paid internship program for rising senior nursing students. They partner one-on-one with an RN preceptor, and the purpose is to help them gain that clinical experience and comfort while they're still in school. So functionally, they practice under the scope of a nursing care assistant 1. So it's a little bit different than when they're in clinicals and they're practicing under an RN license and they're able to give meds and document assessments. When they're a PNA, they cannot do those things, but because they are partnered one-on-one with the nurse, they're still engaged in it. They're performing the assessment, they're just not documenting it. They're calculating meds, they're checking for medication compatibility, they're just not the ones actually setting the pump and hitting go. So they're gaining so much valuable hands-on experience in developing communication skills, critical thinking, time management, all of those important skills that are sometimes hard to learn in short clinical experiences. So the process, they apply, they are able to choose up to 3 specialties that they prefer to work in. Then we have a team that is comprised of our talent acquisition specialist, a clinical educator, and a nursing program manager, and they make the assignments, and we do the best we can to place people where they want to work. Of course, we get a lot of women's, peds, and ICU requests. They can't all go there, but we do our best to make assignments. Our program has been in existence for well over 40 years. Each year we have roughly 60 to 80 participants. We're excited that we're probably going to be close to 100 this year. And we know that we do a great job retaining these PNAs. So we hire about 50 to 60% of them annually once they graduate from nursing school. And then of those nurses that start with us, our managers report overwhelmingly that they typically have a shorter orientation and a smoother orientation process. So that's not surprising, right? They've already worked in that environment. They already know where the gauze is. They already know the communication structure, so they can dive into those more in-depth critical RN skills a little sooner than your non-PNA hires. We also know that they tend to advance into leadership skills a little bit earlier, whether they're formal or informal roles, so they become charge nurses faster. They advance on our clinical ladder a little faster. Oh, and then that is a picture from last year's graduating class. We always have a celebration at the end, which is an amazing way for them to kind of debrief, and it's for the leaders of the program, super exciting to see their confidence and how much it's grown just in 10 weeks. They share what was surprising about it, what they were challenged by, and they overwhelmingly report much more confidence going into that senior year of nursing school. All right, another pipeline program we have is our International Nurse Program, which is near and dear to my heart. So about 4 years ago, we re-engaged international hiring at Duke. We partner with an amazing hiring vendor that helps support us through the process. The reason we opted for international nurses was two. One, we needed more nurses in our pipeline, but we also really wanted to focus on attracting experienced nurses. We are grateful at Duke that we have a very robust new graduate pipeline, but we want to supplement that with experienced nurses as well, and we have found that international hiring has been a great way to do that. So it is a long process. It doesn't happen overnight. Typically, it's about 3 years right now from the time you hire a nurse till the time they onboard. That fluctuates with processes and immigration. And then once our nurses join our team, they have a 3-year commitment to us. But once they join, they are just like every other Duke nurse. They have the same compensation, the same benefits, the same growth opportunities, the same ability to transfer within the organization to other specialties or other areas of interest. So when we interview them, we talk about, just like any other interview, right? Where are you working now? What's your previous experience? What are your goals? And we tentatively assign 3 shadow experiences that align with their area of expertise. So if they're an ICU nurse, we might assign them 2 ICU shadows and different types of ICUs, and maybe a step down, just to give another level of care option. And then when we first started the program, each shadow was a whole entire week, and so they shadowed for 3 weeks and then made a decision. We have since shortened that to 1 shift per shadow, and it's working out fine. The purpose of that shadow is so they go in the unit, they see the patients, they partner with a nurse, they get to meet the team, they talk with the leader, find out what shifts are available should they choose that unit. At the end of the shadows, the leader gives feedback, the nurse gives feedback, and as long as that's aligned, the RN gets to choose what unit they go to. So they have a lot of autonomy in where they're going to work. There's a lot of support, as you can imagine, that goes into onboarding an international nurse. Once we interview and hire, which we have now over 500 nurses as of Monday, so it's a big milestone for us over the course of 3 years, so not overnight. But we provide a lot of support from our dedicated team. We have a nurse manager, a clinical nurse leader. We have a lot of interaction with the nurses before they come. We have town halls to just cover logistical things, current event things. We've covered a lot of topics over time. And then once they arrive, even though they're only in our cost center through that shadowing, onboarding and shadowing portion, then they transfer to the unit that they choose, but we continue to support them. We have monthly retention events, which is just a chance for people to get together and meet other people. Some people come alone, some people come with families, some people are more outgoing than others, so it's a chance for a dedicated space for people to get together. So again, I said we couldn't do this without our hiring vendor, and so there's kind of 3 specific support systems that are available to our nurses through our vendor. So the first is their case manager. So from the minute that we hire them, each nurse gets a case manager, and this person helps them with the logistics. As you can imagine, there's tons of paperwork. There's licensure, there's prepping for visa appointments. Keeping track of all that and providing guidance is the first support mechanism. Second is our deployment specialist. So we, Duke vetted lots of housing options within close radiuses of all of our hospitals, but it's the deployment specialist that actually partners with the nurse to help them make a selection that best fits their needs, whether they're single, whether they have a family, whether they're looking for something fancy, whether they're looking for something basic. We have it all, and the deployment specialist will help them with that, as well as take care of their travel arrangements to the United States. And then the most fun part happens, and that is the day of arrival, when a deployment specialist on the ground in Raleigh picks them up at the airport, takes the pictures with the Duke nurse sign, all the fun things, and really stays with them for the first few days, gets them up to a hotel, feeds them, runs errands, gets a mattress, checks them into the apartment, all those things. So it does require a lot of support to do this well, but we have a lot of great support in place. So some metrics that I'm happy to report. So 88% of our nurses remain in the original unit where they were placed. And I attribute that to that shadow practice, right? That seeing is believing. They knew what they were getting into. They had autonomy in that choice where they were going to work. And they obviously 88% still like it there. So it's a strong metric. So far, we have only had 4 nurses that have finished their three-year commitment. Some as far back as 6 months ago. All of them are still employed with us. As of tomorrow, that number will be 8, so I'll be checking my emails. But we're happy, and I know that's a very low number so far, but that's where we are in this process, and so looking forward to seeing what our retention looks like over this next year. And then overall, 98% of the nurses that started with us have remained. We have had 8 nurses who've left their commitment early, largely to join family members in other parts of the country. But that's, again, we're very happy with that number. As far as professional growth, just like domestically hired nurses, our internationally trained nurses want to grow professionally. So 10% are currently serving as charge nurses. About a third of them are preceptors. Many of them have moved up our career ladder, which I will talk about a little bit more in detail. And we've also employed about 80 spouses, largely as registered nurses and sterile processing techs, but really in various roles throughout our organization. And then in terms of onboarding, the getting to Duke part is obviously very special and complex, but once they're at Duke, largely their orientation looks just about like any domestically hired nurse. So nurse managers report that orientation may be a slight bit longer than an experienced domestically hired nurse, but not by much, and certainly not as long as a new graduate orientation. 97% of our nurses have been successful in that first unit where they were placed. Again, I think that goes back to the shadowing experience. They kind of see what they're getting into. A lot of nurses have had very good self-awareness. They practiced in an ICU elsewhere. They get to our ICU and they're like, this is higher acuity than I've seen. I'm not sure if I want to take this on while I'm also adjusting to life in the United States. They might start in a step-down unit and a year later transfer back to the ICU. So there's a lot of flexibility with that. And then extra support available in our education department partners with us. We have the EMR tends to be a sticking point if people haven't used that before, but there's a virtual platform they can go to. Their preceptors help. So there are, and then we also have a dedicated training day in our education department that focuses on like a mock code, equipment, things like that, just so there's some familiarity with that before hitting the unit. All right, shifting to career development. So talking about what do we do with the staff that we already have at Duke that we want to further grow. So we have apprenticeship programs. So here in North Carolina, our Governor Josh Stein is very invested in growing the people of North Carolina. So we have more qualified people to fill lots of job roles. And so there is a council for development on that. And what is an apprenticeship program? So an apprenticeship program is a learn while you work program. They vary in length. They can be 1 year up to several years, but it's a combination of learning in the job and coupled with classroom learning as well. So once the end of that, it's a progressive process, obviously, like most education, and at the end, the apprentices are qualified and prepared to take their respective certification exams. So currently Duke has 8 apprenticeship programs. We have certified medical assisting, surgical technology, 5 various imaging specialties, and then later this year we will start our registered nurse apprenticeship program. So this is just kind of the pathway of what it looks like. So you're hired into an apprenticeship program, you start learning on the job, coupled with the classroom learning. You are making connections with that hiring team. Hopefully you will get a job right where you are training. And then once you progress towards the end of the education and you're eligible, you sit for the whatever exam is appropriate for your training. Another program we have for promoting and growing and retaining our staff is our clinical ladder program. So this has been in existence for many, many decades and has evolved through time, and we've added additional roles to the program. It's based on Patricia Benner's model of growing or the evaluation of people in their learning spectrum from novice to experts and how they apply that learning into their role. And so we have a 4-tiered system. Like I said, it's available for RNs, LPNs, medical assistants, surgical technologists, and it really is to promote growth, succession planning, retention. So people choose kind of their pathway, right? Maybe I'm more administratively leadership focused, maybe I'm more education based, and so there's options for demonstrating leadership in all of those arenas. And so people will kind of choose their path with that. The process, if someone is interested in advancing in the ladder, is they will talk with their leader, say, hey, I'm interested in advancing on the clinical ladder, what do you think? Leader is supportive, and then they are assigned an advisor. They submitted a formal application, and then they begin working on their portfolio. And so this is a document that showcases all the work that they do. So maybe I'm a pain champion, and I have rolled out some new education, new initiative, and our unit has improved our metrics about pain score documentation. That's something I'll put in my portfolio. And so you submit all of these things. It goes before a review board. And then hopefully you are given your promotion. And like I said, there's up to 4 stages. You can see at the bottom is our current division of just the RNs. I didn't list it for all specialties. So you can see lower percentages in our CN1 and our CN4 categories. And then just about half remain as CN2s. So the nursing care assistant program, I'm only going to touch on very lightly because Kim and Kaylee are going to have a poster about this. But as most of you know, the nursing care assistant is typically a role with very high turnover, yet they're really critical to providing excellent care in our acute care settings. And so we have a couple different options to grow our nursing assistants. One is growing people that are in maybe administrative roles, food services, environmental services. We have classes at Duke that are free, and they are led by our education team, and people can take that class at Duke free of charge and then grow into a new profession. And then secondly, we have similar courses for people who are already nursing care assistants who want to do more. So we can add the NCA 1+4, or they can become a nursing care assistant too. And of course, that brings more autonomy to their work, gives them ability to contribute more greatly to the team. There is a pay increase with that, and so that all helps with retention. And I will turn it back to Sylvia for stipends.
So in addition to our pipelines, we also offer education stipends. So I'm going to talk through a few of them. So the first one, we have Friends of Nursing. Friends of Nursing is an endowment. We had a really grateful patient, and the patient actually started this off by making a pretty significant donation. And we actually used those dollars to recognize nurses for excellence in practice, as well as in education and research. So we actually pay when nurses actually do a podium presentation, when they do poster presentations, but also we recognize 38 nurses each year that's either nominated by their peers or patients with that. Also, through Friends of Nursing, we do grand rounds. Again, I talked about the awards. We actually do seminars. We do support for certification. So about 60% of all of our nurses that's clinical nurse 2 and above are certified. And again, Friends of Nursing actually help support that effort in preparing nurses for their certification. We also do stipends for formal education. So we provide stipends for for people enrolled in to become an RN, we actually do stipends for nurses who are registered nurses, but who are actually in school to get their baccalaureate degree. And then we actually support one nurse each year who's actually working on their DMP. And then that's all through Friends of Nursing. We also have a nurse loan forgiveness program. Our nurse loan forgiveness program is actually offered for new hires, and with this particular program, it's a 3-year program, and after each year, we actually give them a specific amount. We actually have a Duke tuition program, and with that, we actually pay 90% of the tuition when a nurse attends the Duke School of Nursing. And also, we actually have another school that's actually part of the Duke system, and that's Watts College of Nursing. And for incumbents, we actually pay the full cost for any of our employees to go to the Watts College of Nursing. And then, so we talked about that, so. Then another thing that we look at as far as retention, she's coming, so I know it's time. And so I go through this last slide really quickly, is around staffing flexibility, because we know that one of the things that's really important to caregivers is around flexibility. So 90% of our departments self-schedule. We actually also have a really large flow pool of about 450 people. So with that, we're actually able to offer a lot of flexibility.